Dr. Greer, there's another area of alternative medicine or complementary medicine that's really hitting the headlines right now, and that is laser therapy. And it's like a minefield out there. We've got Class 4 lasers, Class 2, we have no idea what they mean or what they can do. I know that the one that you use is the frequency-specific laser therapy.
Yes.
So explain, first of all, some of the things that you might use that for, some of the conditions in the patients that you might see, and what are the benefits of going for the particular laser you have, which is Class 2, as opposed to going with the mainstream ones, which are mainly Class 4.
Well, the big deal for me, and I'm not as astute on this as laser therapy as a lot of people might be, but what I do know is that the Class 4 laser is a more powerful laser. And I grew up in the 60s when a 8-cylinder 4-barrel carburetor was the most powerful car you wanted, and you wanted to really go fast. And there's a mentality out there that the more powerful laser will do a better job, when in actuality it doesn't necessarily do a better job. I think all of them have their healing aspects, but the Class 4 laser is a heating laser and not a healing laser. And the healing aspects of that are primarily reached by the fact that you increase blood flow to the tissue, and all that has a healing benefit to it.
And if I'm right, then the FDA actually, and OSHA, because as veterinarians we're all now ruled by the OSHA board, is that you have to have specific not only notices of what you're using, but also protection devices if you're using one of those lasers. Now, I know you don't have to do it with the Class 2 that you're using, so does that come into play with you?
Well, it's not. If the Class 4 was a better laser, I'd be using a Class 4 laser. I don't feel like it's the better laser. It doesn't really matter. I know the protection that's legally required for the Class 4 is a lot more, that the potential for harming a patient and the operator is more with a Class 4 laser than with the Class 2. I don't think there's any potential harm with the Class 2 laser.
So what kind of things are you using this Class 2 laser for?
Well, if I can digress a little bit, I'd like to go back to why I like the Class 2 in the first place. One is it is frequency specific, so you can dial in a frequency that you need, and different tissues speak to each other in different frequencies. So if you have nervous tissue involvement, which we often treat paralysis with our laser, that's different frequency than muscle tissue or bone if you're dealing with arthritis or cartilage or pain issue, inflammation. All those have different frequencies. So I like the Class 2 because I can be very specific, whereas a Class 4, there is no variation. You dial in a number, you turn it on, and that's all you get. Whereas a Class 2, you can be very specific and treat specifically what you're dealing with. So getting back to the conditions that we treat with it, we've had very successful success so far and no failures in treating hypertrophic or hyperadrenal corticism secondary to pituitary problems. And it works very well. It's medication free, no side effects of the medication, and ultimately it works out to be a cost benefit to the owner. We treat pain with it frequently. We have paralysis in animals. As long as they have deep pain, we've been very, very successful. I think our success rate is about 95% in patients that arrive paralyzed and walking within a week or so of using laser therapy, combined with that of the VOM. So all these things work together, and none of them is 100%, but conventional medicine is very limited to what you can do for these problems. It's either surgery or prednisone or anti-inflammatories, whereas this we can actually go in there and teach tissue to heal. And that's what the laser therapy does, the healing laser, as opposed to the heating laser. The healing laser actually gives the tissue the energy it needs to start healing. And that's what we're trying to do to help these animals. And the results are, I hate to use the word miraculous, but that's as close as I can quantify it. I mean, it really is shocking how well these animals do with it.
And what about the financial benefit to the practice?
Well, it has its financial benefit. We do in ancillary services, X-rays and diagnostic blood work to see if there's any other problems, whether it's X-rays, ultrasound, or blood work. But the practice is better for it, and the patients do better for it, and the machine is a mainstay of our practice. We do 95% of our practice is conventional medicine, but that 5% that is complementary medicine or alternative medicine is what drives the rest of it too.
Now, I know that you treat some exotic animals,
Mm-hmm.
tigers and snakes and bears, oh my, oh my. Can they be used on all those species?
Used on any species.
And you have 3 clinics. Let me ask you a question. Do you have a unit at every clinic?
Yes, we do. Because it was so successful at the main hospital, it was an investment, and I look at everything as much as I can like a business, and is this a profit center that we can use? And it is, and it's one of those things that I know more about it than anybody in our practice group, and it's hard to convey all that knowledge to all the employee vets and the staff. But once they see it work, it sells itself.
There you have it. Thank you very much.
Thank you.